Hello, Dr. Kauser. This is Nick Yale from the Wednesday Micro class. Today I will be making a video depicting an intake assessment. I have conscripted one of my friends into assisting me today. For this assessment, the client is going to be coming in on a court order for drug use and possession. I will introduce myself. I will then disclose to the client her rights and how confidentiality will work with the court system being involved. We will then go into the details of her background. For this video, the client is a heroin addict of 4 years. She has a computer technologies degree and was recently fired from her job for not complying with their drug-free policy. She was then caught trying to buy drugs from an undercover cop. She is attending drug therapy as part of a court order that will keep her out of jail upon her completion. I will describe a drug therapy program known as Matrix. The Matrix program is nationally accredited and is used specifically with drug addicts. I will explain the program and what will be required of the client to complete it. Matrix is an intensive 3-tiered program. The program requires that the client attend both structured group therapy sessions as well as AA meetings each week. This program is very intensive, but has a high overall success rate by those who complete it. We will also discuss job options and the possibilities that are available to the client. As this client has a degree, we will focus on that as a strength and explore possibilities for her to obtain either her old job or a new one in the same field. Many jobs have opportunities for re-employment if the offender can show that they are receiving treatment. For this exercise, we will discuss if her job has options like that. We will schedule her for a group session for the next week. We will discuss her transportation situation to ensure that she can meet the program requirements. I will then discuss payment options. For this video, the billing will work on a sliding scale. As the client will not have insurance, I will discuss the sliding scale and how payment will be rendered for services. I will then walk the client out as if we are heading to the billing department to set her up for her continuing sessions. This will act as a closing of the session. This should provide you with an accurate overview of the topics to be covered. So sit back, relax, and I hope you enjoy the following.
Hi, Lauren, right?
Yes,
Hi,
hello.
I'm Nick. I'm going to be speaking with you this afternoon.
Hello.
So I know a little bit about what brings us here today, but before we get into that, I would like to just talk to you for a quick minute about your rights, what you can expect, that kind of thing. Now, the first thing I want you to know is that you do have the right to not be here should you so choose. Now,
Yeah, right.
I know, there are potential consequences for not doing that, and you are here on a court order. So, but I do want you to know that you do have that right, should you so choose. Now, the other thing I'd like you to know about is that, everything that's going to be discussed here is confidential, except to the court systems. So anything that we discuss, any topics, what your attendance and participation, they all will want to know that because that's how they're going to gauge your sentence and your participation rate. So those things will be sent over there, but other than that, this will not be shared with anybody. So I just wanted to let you know that those are the limitations of these sessions. So I do know a little bit, like I said, I do know a little bit about what you're here for. My understanding is that you were here on a court order for drug treatment, but I would like to hear more of your side of that story. What happened?
Yeah, okay, fine. Started about 2 years into college. I needed to crack down and finals were coming up and I was having trouble focusing, so a buddy of mine hooked me up with, heroin to try to, heighten my senses so I could study better and get through my classes, and it just spiraled from there. I did it for the rest of my college career for 2 years. I managed to, set myself pretty straight after college so I could pass the drug test for my job. But after that, there's nothing holding me back until my 2 years later, my job did a random drug test and lost my job. Kind of spiraled from there. Tried buying from a guy off the street. Was an undercover cop. Who'd have thunk? And here we are. Hello.
I see. So we're both highly aware that you're either come here to be complying, you're compliant, or there's jail time. However, let's take that out of the picture for a minute. Let's put that entire nonsense and mess aside. What kinds of things would you like to see come out of these services?
Not be addicted to drugs.
Okay, we can certainly help with that. You said you lost your job. Are you currently looking for employment?
Yes,
Okay.
I am sending in resumes every day. My previous employer did mention that should I clean up my act and show them that I've been through the rehab process, they'd be willing to look into my case and see if they could maybe rehire me.
Okay. And what kind of degree do you have? You mentioned that you graduated.
Yes, I have a bachelor's in IT.
Oh, very good. All right then. So here's what I think we can offer and what we'd like to do. We have a drug program here called Matrix, and what it is, it's a tier-based program. It comes in level 1, which involves going to AA meetings and attending a certain number of meetings per week here for group therapy. And once you complete that, you move into level 2, which is a few more meetings, a few less sessions, and then you'll come into do level 3, which is aftercare, which is less sessions, less meetings over less time. So it's kind of just really intensive, several weeks. It goes about 3 months or so to complete the entire process. We do have a very high success rate with it, with people who actually put the time into the program and really commit to what they're learning and what they're doing. So do you have a vehicle?
Yes.
Okay. Do you think you'd be able to make these meetings?
Yes.
All right. So that's kind of where we would like to start. And once we get you going in that process, it might be possible to talk to your employer, show them proof that, with your permission of course, show them proof that you're attending these, and then might be able to get you a job of some sort back.
Excellent.
If nothing else, we can then apply for, we can help you to apply for jobs and, kind of explain to employers what's going on should you want that to happen. So, do you have any questions at the moment?
Not that I can think of, no.
Okay. So what we're going to do next is we're going to schedule you for these sessions and get you going with that. Now, as far as billing is concerned, do you have health insurance?
I had it through my previous employer. I believe I lost it when they let me go.
Which is fine. We need to know just so we know what kind of scale to push on. We have a sliding scale here,
Okay.
so we can work with the amount of income that you have and make it so that you can receive your treatment
Right.
based on, your income. And just to reiterate, those files and how you're doing and those kind of things will be available to the courts. Want to make sure that is exceptionally clear.
Right.
That for the most part, confidentiality will be kept here. If someone just were to call in off the street and say, I don't know how Lauren's doing, we wouldn't even acknowledge that you are even a patient here or a client here. But if the court system calls and they have all that information in line, we will have to tell them. So
Right.
I want you to make sure that is clear. So, so what we're going to do next is we're going to go down to billing. We'll get you set up that, and we'll get you scheduled for next Wednesday. Does that sound good?
Yeah, sounds great.
And then
Not
we'll
like I've got anything else going for me right now.
well, you have several things going for you. You have jobs. You have a job, job history. You've got, a degree. So those are what we call strengths. So those are things to focus on. So we're gonna get you working, and we'll get you involved, and we'll see how you do, and we'll monitor your progress throughout and
Excellent.
adjust as necessary.
Right. All right.
All right then. Well, then let's go down to the billing office, and we'll get this taken care of.
Fantastic.